How can the spinal stenosis be treated? Some people say exercise is the way. Some people say it's medicine. Some people say procedure. And some people say surgery is necessary. There are so many opinions. Some say I want to treat it with exercise. Some say I want to treat it with medicine. Some say I can't stand it at all. So I think I need a procedure. It depends on the individual case. Some need to exercise. Some need to take medicine. Or there are people who need a procedure or surgery. So how can each case be divided? There are 5 stages of spinal stenosis. The first stage is a condition in which exercise is needed. In the second stage, medication or injection treatment is required. In the third stage, it requires active injection therapy. The fourth stage, surgery is necessary. And the last stage 5 requires extensive surgery. It's important to know what stage you're at. People in stage 3 should not receive the treatment they need in stage 2. If you treat a patient in stage 3 in a way for stage 4, it is an over-treatment. Therefore, you need to know the stages you belong to first. Patients in stage 4 should receive the appropriate treatment for stage 4, and those in stage 5 should receive the treatment accordingly. That's why you need to know what stage you are at. There are many ways to treat it. The most important thing is the patient's symptoms. The next important thing is the image scan results. Some people have very severe stenosis on MRI scans, but the symptoms that they actually feel are not so severe. In some cases, MRI shows that the symptoms are not severe, but they can't sleep and have difficulty in their daily lives. From the patient's point of view, the symptoms come first because the pain has to be resolved. So the patient's symptoms and the current condition are the most important. Then the exact stage is determined by the results of image scans. MRI scans indicate stage 2, but the symptoms can be stage 4. So what's the stage for this patient? It's stage 4. The first thing that should be resolved is the pain or discomfort that the patient feels. If you feel that, I have a back pain and I feel numbness in my legs because of the stenosis, it's hard to walk a little, so you have to sit down and rest. I think my legs are getting weak and my back is bending. You have to think, I'm now at a high level. There are many patients who think they will solve these problems with exercise, but exercise makes their conditions worse in many cases. It's good if exercise is the right stage, but if it's not, exercise can be rather harmful. When I see patients, not every patient needs surgery. As I said earlier, there are several stages of treatment. Based on the stages, exercise therapy is recommended first for those who need exercise, and if it can be improved by injection treatment, it is recommended. In many cases, after injection treatment, medication is administered and the progress is monitored. However, if you feel that your daily life is even difficult because of the pain, I recommend you to treat it quickly. You do not necessarily need a surgery. It is most important to treat accurately according to each stage. Those who are at stage 1 can get better with exercise. However, if you don't find the right exercise for you and exercise in the wrong way, stage 1 can become stage 2, and stage 2 can become stage 3. Also, stage 3 can be stage 4. It can get worse because of the wrong way of exercise therapy. In spinal stenosis, diagnosis is very important. You need to know your stage accurately and receive appropriate treatment to lead a long and healthy lives. Once again, it's important to have an accurate diagnosis and know which stage you are at. That's all for today. Thank you.
지금까지 척추 전문의 최용수였습니다. 감사합니다.